Hey there, welcome to Equifit Club. I'm Jelaine and I'm your host. And today we're going to talk about those vital signs. As a new horse owner, you need to know what your horse's vital signs are and how to take them. Because when a horse is at rest is when you want to have sort of a standard to go by. That way, if there's something that seems to be not quite right with your horse or something that seems he's a little off some kind of way and you got to make that phone call to the vet, you're going to know if those numbers have any deviation to them. That way, if you're looking at a horse's temperature, for example, you're going to know that average range is 99 to 100.5. That's the normal range for body temperature. Now, if it's above that, then you're looking at a possible low-grade fever, and you're going to want to ask your vet what you need to do. If you need to know how to take that temperature, I got another video that shows you specifically how to do that and to do it properly. Another key vital sign that you need to be able to take is heart rate. Okay? And now these numbers that we're looking for are your horse's heart rate or pulse rate or whatever when they're at rest. We're not talking about what it would be if they just finished exercising or you finished riding or something else like that, or for some reason the horse has gotten excited, because that can send that respiratory rate and pulse rate up. So we're talking about if your horse was just chilling in his stall, that's probably a good place for you to start. So you want to be able to take these things and feel comfortable taking them, especially if you're new to doing this and you're unsure. You want to practice before you really have to do it and you're in a situation where it's a little more high energy. Okay, so we're going to talk about heart rate first. And the only thing you need are two items. You need something as a timer, and then you need a stethoscope. Okay, and I have one like this that I got from just a medical supply house. And I like it because it's a little heavier. Now, there's a range of price for these things. You don't need one that's really expensive. You don't need medical grade, because all you need to be able to do is amplify the sound in your horse's body. Okay? So one of the things that you're going to need to do when you do this is to make sure that these earplugs right here are pointing in a direction where they're pointing down. Okay? If they're pointing down, when you lift them up to put them in your ears, they're going to go directly into your ear canal and you'll be able to hear. Okay? Then you're going to find your horse's elbow. Now we're going to be on the left side of the horse's body. So we want to be right behind the elbow, and you're going to put that little diaphragm right up against your horse's rib cage, right there next to the elbow, and then listen carefully. You want to listen for that sort of lub-dub sound. Boom, boom, boom. And you want to count how many of those you hear in a 15-second period. And then once you've got that number, just multiply it by 4, and it'll tell you what your horse's heart rate is per minute. Beats per minute is what we're looking for. And on an average, you want to hear probably around 28 to 44 beats per minute is usually average. Now, if we're talking about a younger horse, it's going to be different. Might be a little higher. If you're talking about a very old horse, might be a little lower. Okay, but find out what your horse's normal range is, and that gives you a base to run on. Okay, now if you are looking to take pulse rate, okay, that's what the heart rate is, beats per minute. Okay, so in our TPR, our 3 key vital signs, temperature, pulse rate, the third one is going to be respiratory rate. How many breaths per minute? Now, it's important to find your horse's flank area. Go to the flank area when you want to count those breaths. You're counting how he breathes in and out as one. And then how many of those can you count within a 15-second period? After that, multiply it by 4 and it'll give you breaths per minute. Now, it's important that you go to that flank area, because right there, you're actually looking at his breathing. If you go to the nostrils, it's not recommended to try to take that at the nostrils, because sometimes the nostrils will flare and you can't tell or differentiate between when they're actually breathing or when they're smelling something. They get a whiff of something in the air and all of a sudden those nostrils start to activate a little faster. So that's not going to give you a really good reading on how many breaths per minute that you've got. So to round this out, we also talk about capillary fill. And we do have, if you check our video on dehydration in horses, it'll show you specifically how to do that capillary fill. You want to be able to check and see if the membranes in your horse's mouth, if you just take your hand and rub it on the inside of your horse's mouth, does it feel sort of slimy, wet, smooth? That's how it should feel. If it feels kind of clammy, sticky, or dry, then you might be looking at a horse that could have some dehydration. So you want to check for capillary fill. And that means that within maybe 1 to 2 seconds, you want that color to come back into those gums. But check out that video on how to see if your horse is dehydrated, and it'll give you some specifics and some details. So, just as a recap, key vital signs you want to be able to take on your horse. You want to be able to take his temperature, know what his normal range is. You want to be able to take that pulse rate or the heart rate, so you know what that normal range is. And then you also want to know what his respiratory rate is. And remember, this is for an average horse, mature horse, and he is at rest and in overall good condition.